We ran 2 successive projects in Borno State, funded by Global Affairs Canada, and everyone who knows Borno knows that it's currently in a very big humanitarian crisis. The projects are largely on issues that sometimes some humanitarians would not necessarily want to regard as major emergency issues, largely on GBV, gender-based violence, and sexual and reproductive health right, SRH.
The ultimate goal of the project is to save lives, alleviate poverty, and then maintain dignity of women, men, boys, and girls in Borno State through gender-responsive SRHR, GBV, and WASH intervention. For the SRHR component, it has 3 different subcomponents. The first is community awareness on sexual reproductive health and rights. We have community-based volunteers that go out to the community and sensitize community members on SRHR-related services and information. The second subcomponent for the SRHR, we have the Lifesaving health services, whereby using the mobile clinics, where the mobile teams move from one area to the other in the LGAs to provide SRHR services to community members.
We have 3 main areas that we use to render our services. We have Musamari Outpost, and we have Rabiri Clinic. And we also have mobile clinic that we use to go to IDP camp and host community. That is 5 times in a week from Monday to Friday. For the mobile clinic, when we have any complicated cases, we used to refer to the Rabiri clinic for special intervention. If the cases need referral, then we used to refer to General Hospital, which is our referral center.
We also have the components where clean delivery kits are given to visible pregnant women to help them have a safe delivery.
Most of these IDPs, they come for labor empty-handed, without even common pad. Talk less of Dettol, talk less of hand glove. And at a point, the service provider may not use his bare hand to deliver such women. Fortunately, CARE NGO came in and donated dignity kits. Each kit comprises of sanitary pad, 2, hand glove, 2, surgical blade, soap, Dettol, spirit, cut clamp, and white 2-yard sheet. Is to wrap the baby after delivery in the absence of towel. It has gone in a very, very long way in easing our problems. The healthcare staff become confident because they have hand gloves inside. And secondly, if without this you ask the patient or the patient relative to go and buy hand gloves, in some cases they will say they don't have even the money to buy these hand gloves because they are from the camp. So the dignity kit has been very timely, and it has given a lot of relief to both the clients and the service providers.
For the GBV component, we have Women and Girls Safe Space, where women and girls come to the safe spaces for psychosocial support. Some come there for case management, some come there for recreational activities, and also some come there to learn 1 or 2 life skills.
A lokacin kiyasu suna ba su zuwa kan ba abin da zan yi, ba sana'an da zan yi. Wata rana ba ma cin abinci, kuma ba wanda zai ba mu. A haka muna kwana. Tukuna in kiyasun zo su kuna. Mun fara aiki, muna cin abinci a lokaci. Yanzu mun koya sana a cikin safe space na kiya. Na koya wannan keken dinki. Yanzu na samu keke, ina yi da shi, muna cin abinci. In na samu kudi, ban san da namiji ba, ban san nawa ba. Ni da yaran mu muna dafa abinci muna ci. Da har mutanen ma suna zuwa gidana ina koya musu. akan wannan. Rayuwa na da yanzu ya canja.
The GBV Protection Committee members are well-respected individuals, men, women, and then youth in the community, and they serve as our focal points for GBV services. They sensitize community members on GBV-related issues.
Kumani ani training now, kia gagia training as a GBV champion. Aikin da muna yi, misali, aikin da muna yi, muna awareness ma mutane wanda suna cikin house community da abunan. Muna bi house to house, muna bi gida-gida, muna musu awareness akan GBV, gender-based balance, akan kasan wadansu wanda ba san da lokacin da kamun ai train nan ba mu san menene GBV ba. Ana musguna ma abunan, ana keta hakkin yara da mata.
Then we also have the components where we support our women and girls with men in the community and adolescent boys with dignity kits for those that are really in need of those intervention.
Ba mu da komai, ba mu yi noma, ba mu yi kasuwa, ba mu koyi saboda haka ne ai mu tallafi ta mai ko wanda ya ba mu. Tallafi gaskiya dadin muna samu tallafi kala-kala na abinci, muna samu na gidaje kaya da kuma na daban abinci da dan riga sa da kuma wasu yan mata mu kuma suna samun riga na turmi da kuma wasu zai samu da kwana wanda suna sa abinci da kuma wasu taburma wanda una kwana.
The wash component of the project was designed to help the sanitary facilities in the health facilities with hygiene supplies and also to improve the sanitary condition of the facilities. The project also had hygiene promoters that promoted hygiene components that sensitized the community members on how to improve their sanitary conditions of their environment.
Before the coming of GAC project, the cleanliness of the facility is bad. If they come as the clinic has poor hygiene, instead of getting well, they will increase more disease or infection. Even it will harm them. But as intensive of GAC project, we have a lot of changes. The clinic is now very neat. Before we don't have pit latrine, but now we have pit latrine.
This intervention had helped in advancing conversation on GBV in this part of the region. We really thank our donor for making the resources available in two successive ways. We also thank our partners. We couldn't have been able to reach where we were able to reach without our local partners who support the implementation of this project. The Borno State government has been really very important in the program design, implementations, and review. And we hope what we have done with the state government will be sustained. And I also particularly thank the very committed staff who drove this project with tremendous passion and working across very difficult, hard to reach communities, people who are suffering under these 12 or 13 years of crisis in the region. So above all, I think it's been an excellent project, and we look forward to continue building on these forms of intervention.